why do I still have thyroid symptoms when my lab tests are normal? Now, of course, you can have lab tests that are not normal, but many people are running around with lab tests that are actually normal, but they still have thyroid. Before 1970, we used to diagnose thyroid primarily by symptoms and signs. You come to the doctor, he runs a number of physical examinations, or goes through a battery of physical examinations, asks you questions and so on and so forth. And through that process, you could really get a good handle whether somebody's thyroid was working properly. Now, I'm not against the test. I think the tests are wonderful. But when you use the test as your only guide of what's going on with the thyroid, you're really going to miss. You're really going to miss a lot. And as we go through this, you're going to know more of this. Now, some people estimate there's 26 million people that have thyroid problems, and some people estimate up to 52 million people. Now, that's 1 in 5 Americans that are dealing with some level of thyroid problem. Very interesting. Most of these thyroid problems are autoimmune driven, so they're really not even thyroid problems, if you will. They're immune system problems. And this is Hashimoto's and Graves', but Hashimoto's by far more common. What I'm going to do here is we're going to go through first and talk about just kind of the signs and symptoms of what it looks like. Because I think that sometimes, you know, you'll see yourself in this or you won't see yourself in this. So if you see your wife in this, don't point it out. That's not nice. So I'm just kidding. Okay, do you suffer any of the following symptoms? You may have a thyroid problem: fatigue, weakness, muscle cramps, irritability. Now, definitely don't point that one out. Depression, weight gain, and I'm not going to say that one. Difficulty losing weight, constipation, intolerance to cold, decreased libido, memory loss, and hair loss. There's a lot of other things that go with thyroid problems, but this is definitely kind of a cookie cutter of what we're looking at. Now, what I'm going to do is back up from this for just a moment, and I'm going to pull away from this, and I'm going to go to this guy right here and see if this works, because I want to give you an illustration of what it's kind of like, the thyroid function. The thyroid, if you will, is the energy that makes all the cells work. That's what the thyroid hormone does. It makes it gets into the mitochondria, which are the energy producers in the cells, and it even changes the gene, or turns on genes in the cell to make it activate and move and go and be alive. And if you can think about it, I thought this was a great illustration. When your thyroid's working normally, it's like all these pistons are going. You see that? And then when the thyroid starts getting sluggish, you see that? That is I mean, I was the one that came up with the illustration, but that's a great illustration. I'm not trying to brag on myself, but I'm saying that is a fantastic illustration. Thank you very much. That's a great illustration because that shows us really what's going on. This is the reason why thyroid problems will touch almost every single health condition there is. Because every cell in the body needs the thyroid hormone in order to activate it. Does that make sense? Okay. Here's a picture of what the thyroid looks like. It's the butterfly looking thing down here. And you can see the nodules, and not the nodules, but you can see the shape, and sometimes people develop nodules on it. It's located right about here, just like that. And just to go through some schematics of how the hormones work, I want to take a moment to do that, and then we're going to go back over the signs and symptoms. This right here is a place called the hypothalamus, and this is a place called the pituitary gland, and this is the thyroid. Okay, so they've pulled that square out and they've pulled it out right here. The hypothalamus releases something called thyroid releasing hormone. So it releases a hormone and it goes down to the pituitary gland. The pituitary gland releases what's called TSH. Who's heard of TSH? You've heard of TSH. Okay, so thyroid stimulating hormone, or we'll call it TSH, goes down into the thyroid, and when the TSH hits, there's receptors on the thyroid that receive that TSH, and when it receives it, it begins the activation process of building the T4 primarily and T3, which are the different thyroid hormones. Okay? So also this runs on what's called a negative feedback loop. A negative feedback loop looks like this. Once the T4 comes out of that thyroid, the T4 is going to go down into the thyroid, 60% of it is going to go down to the liver and it's going to be converted into T3. Now why that's important is T3 is really the most active form of the thyroid hormone. So in other words, cells use the T3, or it's a more potent form of the hormone, if you will. 20% of it goes into the gut, and the other 20% is not used. So not all the thyroid hormones used, but anyway, you'll see circulating in the system the T4s and the T3s. Well, when it circulates in the system and then it comes up into the hypothalamus and the pituitary gland, boom, certain levels happen. It's a negative feedback loop. In other words, it'll stop the production of more of the TRH and the TSH. Does that make sense? Isn't the body awesome? I mean, you know, when you look at the way the magnificent wonder of this body is, I don't know how you would not see that there's a creator behind this. There's just impossible. We would not, I mean, if I was putting the thyroid together, I wouldn't have thought of that. That's a pretty good idea. Pretty good idea. Okay, so the effects of an underactive thyroid. I'm just going to go through some things to show you all the different places that the thyroid can touch. And this is, by the way, this is not all the different places the thyroid can touch. This is just things that we can kind of put our, stick a fork in. Bone metabolism. It manufactures and stores calcitonin. Calcitonin is actually something that regulates the calcium levels in your body. So if your thyroid's not working right, it can actually pull calcium out of the bones, or it can do things that it doesn't need to do. And sometimes we'll see somebody when they have thyroid problems, we'll see those calcium levels rise. GI function, constipation. You know why this is? It's very simple. Everything's slowing down. Everything's slowing down. Everything's slowing down. Well, the problem with everything slowing down when you get in the GI tract is this is an area where, you know, I'm not trying to be funny, but things need to move. I mean, because what happens is the slower things work in that area, the more susceptible you become to bad bacteria, viruses, infections, parasites, fungi, and all these other things. We need movement. I'm sorry. I was a little too excited for that. Okay. We do need to have normal GI function, okay? Male reproduction, lowered libido, and even lowered sperm count. Gallbladder and liver, the detox pathways, it contributes to gallstones. So in other words, if you have a low thyroid, the liver is the major detoxifier of the body. It cleans the blood. It's what keeps us clean. If you didn't have a liver, you wouldn't live. So the liver, that's what they call it, the liver, you ever think of that? Okay, never mind. So, but anyway, the liver is the major detoxifier in the body. Well, what happens is if you don't have enough thyroid hormone in there, it blocks, or actually it inhibits some of the enzymes that are important for the detoxification pathways to take place. So guess what? The body doesn't detoxify like it's supposed to. You know, there's a lot of people out there that, and I don't blame them, you know, because you hear a lot of things about going this detox, going that detox, and I think those are generally okay. But what happens is sometimes people will have like an underlying thyroid problem and not realize they're not detoxing well. They're not detoxing well because they've got another problem going on. Okay, growth hormone. This is what we call the anti-aging hormone, because we think about growth hormone in children, but actually you can measure somebody's how fast they're aging by their levels of growth hormone. That's why it's important to exercise. That's why it's important not to eat these really carbohydrate-rich diets and these sugars and all these other things. And I'm going to go into it and tell you a little bit about grains. I know I get on people's bandwagon when I'm talking about grains, but grains and sugar and all these different things can have an effect that decreases our growth hormone levels. It's very important that our growth hormone levels are good. But what happens is the thyroid is important in one of the conversion processes for the body to produce the growth hormone. So guess what? If you don't have enough thyroid, guess what's happening? Are you guys kind of getting a picture of how many things this is touching? Fat burning. This is the one that usually gets people's attention. Slow metabolism. Why is it? Just slow. Everything's slow because there's not enough energy in the cell to make it work. It's not burning fat and all of that, but it interferes with an enzyme called lipase. And lipase is an enzyme that helps you metabolize fat. Guess what? If you're not metabolizing fat, guess what you store more of? Fat. Right. Exactly right. Exactly right. Not only that, I mean, I don't want to get too far off the beaten path. I have no time to get off the beaten path very far at all. But let me just say this real quick, and that is that one of the things that happens is if you're not metabolizing fat properly, your body starts using sugars, and then that starts fouling that up, and that throws people into hypoglycemic problems. You throw people into hypoglycemic problems, that leads to more thyroid problems. So the whole thing just is like a loop that goes around. You got to get a hold of it. Insulin and glucose metabolism. Insulin needs thyroid. Well, let me say it this way. When in the presence of thyroid, insulin works much more efficiently in getting the glucose in the cells. Okay? So if you don't have enough thyroid hormone that's circulating around, the insulin becomes less efficient. Guess what happens when the insulin is less efficient? You start producing more of it. Well, this is a problem. Insulin is good in very small quantities, but it's very bad in any bit over the small quantities, because it becomes toxic to the body, and the liver first, and then the muscles, and then the fat cells become resistant to the insulin, and this starts a cycle of blood sugar problems. Here again, blood sugar problems relates to thyroid problems relate to blood sugar problems. This is really why people feel awful. Sometimes they have the blood sugar shifts and everything's going crazy. And your brain primarily feeds off of glucose. It doesn't really feed off the fats and proteins. It feeds off of the glucose. And therefore, if your glucose levels are like this roller coaster, like we used to ride the Screaming Eagle, if your glucose levels are like that, you know, and and your spouse says you're irritable, then you probably are. Okay, good. I was trying to say that nice and whatever, but your brain is very important. Depression, cognition, just a lot of different things can do with that. Brain chemistry. Estrogen can lead to proliferative associated. Okay, there's something called a proliferative estrogen, and what this is estrogen circulating your body. And it has to be, before you can eliminate it, you have to convert it to water-soluble estrogen. In other words, fat-soluble, you have to convert it to water-soluble, and that's done in the liver. And if the liver does that, then it goes out through the urine, goes out through other processes of sweat and so on and so forth, and we don't get excess estrogen. So, but what happens is if the liver is being messed up because there's not enough thyroid hormone in there, it blocks its ability to really convert that estrogen right or properly. So what happens is you start building up more estrogen, but it becomes a different type of estrogen that becomes a little bit more toxic to the body, and they've linked it with breast cancer, uterine fibroids, and ovarian cysts. Am I going too fast? Are you guys okay? Okay, liver detox, and there's one thing, if you guys want this PDF or want these, I'll get this out to you. So if you want to just take this home and read some of this. Liver detoxification pathways, we talked about that. Stomach acid production. This is very interesting. If there's not enough thyroid hormone circulating around, it'll cause the stomach not to secrete or make enough acid in the stomach. This is a very important issue. The reason why is because you have to have acid in your stomach. If you guys came out to the food sensitivity seminar we did a month ago, we talked a lot about the stomach acid and its importance. If you don't have enough stomach acid, you're not going to be able to absorb B12 as well. You can't absorb your proteins as well. You can't absorb your iron as well. There's just a whole cascade of events that can happen if you don't have enough acid. By the way, what is one of the number one over-the-counter things people do? Digestive aids, digestive this, digestive that. The natural ones are generally okay, but when you start getting into like the proton pump inhibitors, you know, somebody has like a acid reflux, or they've got the heartburn, or they got whatever, and they're taking these drugs. Well, what they don't realize is that there's not enough acid in the stomach in the first place. That's the reason why they're having heartburn. I know that doesn't make sense. I'm going to give everybody a copy of the food sensitivity seminar I did last month, and you'll get that, because I got to move on. But I will say real briefly that when there's not enough acid in the stomach, Kathy and Shane know this because they were here, there's not enough acid in the stomach, your body doesn't digest the foods properly, and so the small intestine begins to reject it, and it comes up this way. And so the esophagus doesn't like any acid at all. So even though you don't have much acid in the stomach, any at all that touches the esophagus is going to burn. So when people have indigestion or heartburn, it's usually from not enough acid, and there's food sensitivities issues and other issues there. But anyway, it's very important. Body heat and hot flashes. This is very interesting. Body heat and hot flashes. Because most times when people have thyroid hypo or an underactive thyroid, they're going to have cold hands and cold feet. Not all the time, but a lot of times. And the reason why that happens is because the heart relies on thyroid for the energy to make the contractions. And the heart just doesn't have enough boom to get all the full circulation. But since thyroid also has to do with the regulation of temperature in the body, it can just flop it up and just have all kinds of problems with it. You can have problems with body heat, or these people having the hot flashes. And a lot of times this can be confused with perimenopause, menopause. Yeah, I'm just going through menopause, just going through the changes. Don't realize maybe it's a thyroid problem. Thyroid progesterone connection. I've only got a couple more of these, thank goodness, right? Thyroid progesterone connection. This is very interesting. The progesterone is necessary, or it actually aids the thyroid in making the thyroid hormones. It gets along with what's called the thyroid peroxidase, or TPO. It gets along with the TPO and the thyroid, and it helps produce. So if you don't have enough progesterone, guess what? That can be a cause of hypothyroid. Absolutely. Oh, you know, what's very interesting is, you know, women in ovulation, when they ovulate, their temperature goes up, doesn't it? Right? Well, the reason why that happens is because when you ovulate, the progesterone's going up. When the progesterone goes up, it causes more activity in the thyroid. That causes the body to warm up more. So it's a pretty accurate way to see the ovulation. But not only that, but the thyroid, actually, the thyroid hormone is important for the receptors on the cells to receive the progesterone. So what can happen is if somebody has a thyroid problem, it can look like a progesterone problem, which are things like heavy bleeding, weight gain, headaches, these kind of things. So they can have what looks like a progesterone problem, but it's really a receptor problem because the thyroid's not helping it get into the cell. Does this all make sense? I'm afraid I'm going through too much stuff here. I really am. I know that this is, you probably feel like I just got a shotgun, a machine gun up here, but it's going to slow down after this. Number 17, we're going to slow down a minute. Okay, anemia, we talked about this a little bit. If your acid is not enough in the stomach, you're not going to be absorbing your B12, folic acid, and iron. But also, going back to what we were talking about, Hashimoto's, which is the hypothyroid, the autoimmune condition of hypothyroid, which is Hashimoto's. And Hashimoto's many times, no, let me retract that, because the number is actually 12%, which wouldn't really qualify to be many. But 12% of the time that somebody has Hashimoto's, they also have a pernicious anemia, which is an autoimmune condition that goes after and eats up the intrinsic factor in the stomach, not allowing the B12 to be absorbed. So, also protein binding, sex hormone binding hormones can be reduced. Well, if you think about it, there's proteins that carry hormones all over the body, and these are called protein binding. And the hormones are sex hormone binding proteins. They can be reduced when you have a low thyroid problem. The reason why that's important is here's your hormonal imbalances. A lot of times people have hormonal imbalance. They think, well, I've got a hormone imbalance, and not realize the underlying cause is the thyroid. Let me stop right here and just say this, that any time that we're dealing with any kind of condition, it doesn't matter what the condition is. We always have to fundamentally go back and find out what's causing this, what's driving this to happen. Does that make sense? I'm telling you all these things not because I'm trying to, I'm not going to give a quiz afterwards. Actually, I went through that whole list because I wanted to see, when you looked at this, did you see anything on there that you think, wow, that could be me? Yeah, see, that's pretty easy, isn't it? And that's where and not all those things will apply, and not everybody has thyroid is going to see issues in this and that, or whatever arena. But I just want to show you that. I'm sorry to take you through that process, but I want to show you that. The next thing we're really going to go through is talk a little bit about how the thyroid gets in the cell, and then we're going to show some pictures, which is a lot more fun than reading slides, okay? It's likely that all cells in the body are targets for thyroid hormones. In other words, what this means is every tissue cell in your body needs the thyroid hormone in order to generate the energy that it needs to generate. While not strictly necessary for life, I will say it definitely causes disease processes. Everything from heart attacks, even cancer and other things can be the long-term problems that can result from somebody having chronic low thyroid, for sure. Let's just go on. Fishes. Thyroid hormone activates the mitochondria within the cell. Okay, let's take a moment and look at this. Pictures are more fun than words, right? Okay, good. This is the pituitary gland. Remember we talked about it releasing the TSH, remember that? And when the TSH hits the receptors on the thyroid, that activates the thyroid to make the thyroid hormones. Remember that, okay? And then the thyroid gland releases it right into the circulation. This is into the circulation, it's a blood system. Then there's transporters, or in other words, I would like to use as receptors. There are receptors on the cell. This is a tissue cell right here. Now I blew this slide up like this, I stretched it out a little bit. So normally we'd see a round cell. Now we have an egg-looking cell. But anyway, it doesn't just look like that. So I just did that so I could see a little better. But anyway, on the outside of cells, there's little things that look like TV antennas that are little receptors. Now it's very interesting, these receptors actually control what goes on in the nucleus. We used to think, and I'm saying as a body of science, years ago, that the nucleus was the end-all be-all, that it did everything. Now we're coming to realize that it's these receptors on the outside of the cells that are activating what's going on in the nucleus. Does that make sense? This is going to make more sense when we talk about this a little bit later, because I'm going to be talking about these receptors. So the receptor right here sees the thyroid hormone and brings it right in, okay? All right. Here's the thyroid gland, here's good, TSH, thyroid gland, and makes a lot of T4, a little bit of T3. It actually goes down in the liver converts a lot of it. I want to show the slide just to show you when the T3 comes here, some of it comes here and goes straight to the mitochondria, others will go right into the nucleus, and it actually, a combination of the receptor and the thyroid hormone will actually turn on genes within the tissue cell itself. This is what causes it to activate. Is this all making sense? Okay. The effect of the hormone receptor complex binding to DNA is to modulate gene expression. How important is that? I mean, that's everything. Gene expression. Now, we used to think that once you have your genetics, that's just the way it is. But now we realize that genes you can turn on genes, you can turn off genes. And so there's receptors outside the cell that make this happen. I'll give you just a little tidbit before we go further, but if you have a receptor out here that is not picking up or not really seeing the thyroid, guess what? Thyroid's not going to get in that cell because the receptor's not seeing it. So, okay, that's another point. All right, let's go through some stuff. I'm definitely not picking on this lady. I don't know. I just picked her off the internet. I apologize. But I wanted to show you something here. There's something called myxedema. You see this right here? You see that puffiness under the eyes right there? When you see that, that is a thyroid case. There's very few things that you can look at and just say that is a thyroid case, but when you see that sign right there, there's a thyroid case that had to produce that. There's also, you'll see, let's see if I've got more right here. Here's another couple signs. Now this is a before and after. So if you look at this, you see his hair is more thin up here. See, thyroid will make the hair more thin. Guess what? It makes it more coarse. Can you see it's a little more coarse? The hair's a little more coarse. Can you see the myxedema? Can you see that the eyes right there? See, you can see that right there. All right. Here's some physical signs. If you have toenails that have fungus on them, if you have fingers or toenails that have fungus on them, this is a sign that you may have a thyroid problem. And the reason why is because it's a circulation. You're just not getting enough circulation, not getting enough oxygen down there. And when you don't have enough oxygen, it becomes a breeding ground for fungus to grow and so on and so forth. If you can take your skin like this and push it like this, you all can do this. I know you want to do it. Go ahead. If you can take your skin like this and pull it away like that, that should turn back red pretty soon. If it's delayed, in other words, you see how it's blanched right there? If it stays like that for a little while, it could be a thyroid. This is a scalloped tongue. One of the things that a thyroid problem will do is cause you to have a little bit bigger tongue. And so it'll cause it to scallop a little bit. Thyroid problem also doesn't allow beta carotene to readily convert to vitamin A. It's another problem, but when it does that, you can have yellow palms and yellow feet, but not yellow jaundiced eyes. You have the other signs of that. And here's another picture. It didn't really come out that great, but can you see that right there? You know what that is, right? You've seen that when people have that swelling like that. It's the thyroid. Did you all know that thyroid has so many things to do with so many other things? It is unbelievable. Here's a coarse hair. You see that? And not only that, here again, I'm not picking on this lady. I think she looks fine. Just, keep it at that. But if you look at it, the hair almost looks kind of lifeless. It doesn't have that, that luster to it. Thinning of the hair, we'll sometimes see that, the thinning of the hair right there. It can be chronic inflammation. These people will just have pain. My shoulders hurt today. My shoulders hurt today. My knees hurt today. My hips hurt today. I've got this going on. I've got that going on. And just simply, think about those pistons going. If you've got tissue cells that are they're moving, think about this. Every tissue cell produces a product. It gets rid of waste, and it does its deal. It reproduces itself. So if it's vibrating and it's really chugging along like it's supposed to, these things happen well. It fights off infections, fights off this, fights off that, and you have healthy production of the stuff it's supposed to make. But if those pistons slow down and we don't have enough thyroid in there, the tissue cells now will react in a way that they're not really producing the product as well. Now, if that product has to be a liver detoxification pathway, then you're not detoxing as well as you should. You could take that example anywhere, what we're talking about. Fatigue is another. the pistons just aren't moving, so there you go. Other signs and symptoms: cold hands, cold feet, menorrhea, more advanced stages, amenorrhea, PMS, chronic infections. Why is that? Here again, what did I just say? The tissue cells are slowing down. When the tissue cells slow down, this is an invitation for bacteria, viruses, and everything to come in. Weakness, ascites. That's the pot gut right there. When somebody's not fat, you look at their whole body, they're lean everywhere, but they got choop, choop. You should call this a beer belly. So there you go. Elevated or depressed cholesterol. If you've got a hyperthyroid, it'll throw your cholesterol down. And if you have a depressed thyroid, it will increase your cholesterol. Now, you know why that would happen is because if you have all these problems metabolizing fat, what are you gathering a lot of? Fat. And over a period of time, you start elevating, you can elevate cholesterol levels. Low basal metabolic rate. We're going to talk about this in a little bit, but let me say this about it until we get to that section. You can actually measure your temperature before you get out of bed in the morning. Good to do it under the arm. 97.8. I suggest doing it 10 days in a row. If you are menstruating, do it at beginning the second day on, and do that and get an average. And if you're under 97.8, you do have at least an underactive thyroid. Memory. How many people have that problem? Brain fog. Ever heard of that one? Brain fog. Heart palpitations, constipation, depression, hypochlorhydria. We already talked about this. Morning headaches that wear off as the day progresses. Like, you wake up in the headache, but after a little while, I get up, I feel a little better. Weight gain despite adhering to a low-calorie diet and punching your clock at the gym and working on the treadmill for an hour. You're still gaining weight. This is thyroid, more than likely. Hypersensitivity to cold, itchy, dry skin. Itchy, dry skin. Itchy, dry skin. Hair falls out. I wasn't pointing at myself on that. Loss of outermost part of the eyebrow. If you look at the lateral third of the eyebrow, if you see the lateral third of the eyebrow becomes more thin, then you likely, and everybody's looking at me, but I have light eyebrows. They came from my mother already. But no, if you have lighter, like a real bushy hair like this, we should bring Joe up here because he's got a great example of what it's supposed to look like. He's bushy all the way through there. Loss of outermost part of the eyebrow, slow wound healing. Why would you have slow wound healing? It's not enough energy. You got to have energy for the body to work. Mental sluggishness. Why? You got to have energy for the brain to work. All that. Okay. Look, you've got to stop thinking that one little pill is going to solve all your problems. You need to take at least 4 twice a day. Well, if you think about it, no wonder, because do you see all these things we've been talking about? Now, if you just thought we were going to talk about this little butterfly thing here and that, had a little bit to do with something, but I don't know, you might be surprised to see how many things that this thing is touching, you see? And so, what would happen if somebody went to went to a doctor that was not, was basically just running what they usually do is a TSH and maybe a T4, and they looked at it and looked normal. But let's say this person was fatigued all the time. Let's say that they had acid reflux. Let's say they had a lot of joint pain. I mean, we could go on. Let's say they had heart palpitations. These are all things that can go with this. What would they do? What would you do? They would give you a drug for the joint pain. They'd give you a drug for the heart palpitations. They'd give you a drug for the acid reflux, and every single one of these would make the problem worse. Every single one of them. We have to get to the cause of the problem. I'm not anti-drug. What I am against is anti-solving the problem. It's not good enough just to know what something is. We gotta fix it. And I got to tell you, it's a lifelong pursuit. It really is. When you see you've got a problem, you've got to get it corrected. And because this is the way I understand it, this is my one time through. So I'm gonna make sure this body's working right. At least while I'm here, I can enjoy it as much as I can. Do thyroid tests, blood tests lie? And I will say not if they are properly ordered and correctly interpreted. Now, here again, let me just put the caveat out here and say, I'm not railing against anybody. I'm just trying to teach this for it to be understandable so that when you are dealing with this, whether you're seeing me or you're seeing somebody else, you really need to know really the facts so that it'll help you make the best decisions. Does that make sense? Okay, very good. Let's review one more time and talk about the blood test. First, you remember the hypothalamus releases the TRH, and it goes to the pituitary. Once the pituitary sees that TRH, it makes TSH, which goes down to the thyroid, and then that activates the thyroid to produce the thyroid hormone. Does that make sense? Okay, so then the thyroid hormone makes T4 and T3. Not as much T3, it makes a lot of T4. It goes down to the liver, a lot of it's converted into T3, the more usable form of thyroid, and then it goes into the body, and then all this T3 and T4 is circulating in the blood, and then it comes back up to the hypothalamus and pituitary. Hypothalamus and pituitary says, aha, I see enough of that, we need to shut that off. Does that make sense? Isn't that cool how that works? That's called a negative feedback loop. My wife and I had it was actually my wife had a baby. I was there 2 years ago, and she's going to be turning 2 in 1 month. But I realized at that time when we did a home birth, and I realized at that time when she was in the midst of having all those contractions, there's something in the body called oxytocin that's released, and that causes the contractions, right? Well, I realized that that's the one positive feedback mechanism. What that means is once you get a little, you keep on getting more. There's no stopping that process when you get in the middle of it. I realize that. Like, there's no stopping. There's no taking a break. Like, okay, let's take 2 weeks off and let's think about it and let's strategize how we're going to do this. I mean, you're in the midst of it. There you go. Okay, that was just me. I'll take that out of the tape. But anyway, I enjoyed that process. I'm not going to say that. I'm definitely cutting that out of the tape. Okay. Okay, now when we look at the pituitary, was I standing right about there? No, I'm just kidding. When we look at the pituitary and the TSH and turns on, turns off, so on and so forth, this is generally what happens when people go to a doctor and they have this symptom or that symptom. They're checked, and they will be checked for the TSH levels. That's the most common thing. It's a fairly cheap test to run. You see it. The problem is if you have Hashimoto's, your TSH may be high, it may be low, it may be normal. If you have 6 patterns, I'm going to show you 6 patterns of thyroid problems that are not Hashimoto's. Only one of those 6 will predictably have a high TSH in those cases. So 5 out of 6 of your patterns of hypothyroidism and Hashimoto's, none of them will show TSH necessarily consistently as being abnormal. Doesn't that give you a little stability? I'm going to show you what to do about it. Okay, so basically what happens is, let's say we have this turns this on, the T4 comes over here and it turns it back off. So that's a normal working situation. Now if the TSH is low, then we would equate that with hyperthyroidism, with the thought that there's so much of the T4 out there that the TSH is is calming down because it doesn't want any more of it, so it's slowing it down. The reverse also happens in hypothyroidism, and that is that in this case, the pituitary gland is not seeing enough of the T4 floating around, so it produces more of the TSH. Now, if that's all there was to it, that would be great, but there's a lot more to it. You have to think about the receptors in the cells, you have to think about the health of the mitochondria, you have to think about whether your immune system's chewing up the thyroid gland, you have to think about more than just that case. Okay. Here's what a comprehensive thyroid panel looks like, and here again I'm going to give you this list if you like that. Thyroid stimulating hormone, you need T4, free T4, and all these, and this is a very important one at the bottom. This one's hardly ever run in a general test. It's called a TPO antibody and a TGB antibody. Why these are important? TPO is that's that thyroid peroxidase. That's that TPO that works with the progesterone we were talking about. The TPO, that's a primary target for Hashimoto's. So what that means is when your immune system flips on its head and there's an immune dysfunction going on, dysregulation going on, it will sometimes go after that TPO. And when it goes after the TPO, what the body does is when it goes after something, it marks it and says, we don't like this anymore, and it actually makes an antibody towards it. See, that's a really bad thing. See, because when you got an antibody running around your body and it's connected to a part of your body, then it's eating that part of the body. Does that make sense? That's what's happening. Okay. So, but most people don't check this or don't get this checked. And the reason why is because whether if you've got a hammer, everything looks like a nail. And the primary treatment for any kind of hypothyroid problem is going to be Synthroid or something along that lines. So whether you are Hashimoto's or whether you're not, generally the prescription is going to be a Synthroid or some kind of thyroid hormone. Here again, we didn't get to the cause of the problem. We need to find out what's causing the problem. Okay, so we run the TPOs and the TGBs. And I'll tell you what, people are very thankful for that. Very thankful. Because if you have a Hashimoto's and don't know it, it's not good. But if you have a Hashimoto's and know it, it's not great. But at least you can do something about it because you know it. All right, so there you go. Okay, pathological versus functional interpretation of blood. All right, now when we look at blood tests, here's one more thing, and then we're going to skip off to something that hopefully is a little more fun. When we look at blood tests, this further complicates the problem. Because when we look at a blood test, we can see what they call pathological values or clinical values. So when you see your blood test, you look at it and you say white blood cell is between 4 and 10, or the red blood cells between this and that. When you see your labs, you know what I'm talking about. When you see your papers, you see your labs. These are what are called clinical ranges. Now they're different from lab to lab, but they're usually pretty close. How they do that is they'll take in hundreds or thousands of blood tests, and then they start running the averages and find out where the outliers are, and they call that the clinical ranges outside and inside. There's another range called a functional value, or what I like to call healthy ranges. You should be within healthy ranges on your values, because when you get out, you could be outside of a healthy range but still be within clinical range. You still got a problem going on. It might not be a disease, but you still have a problem going on. Does that make sense? And give you a great example right here. For TSH, pathological values are from 0.5 to 0.55. Most people that go in with all the things I've been talking about, all for the last however long I've been talking, when they go in, they'll get a TSH done, and their TSH will be like 1.4, or it could be it could be maybe 4 or something like this. It's outside of the healthy range, and they definitely have a thyroid problem. But we wouldn't call it pathological, but it definitely is a thyroid problem. Does this make sense? So that further complicates the situation. I'm going to make you feel better about this in a little bit. Okay. The majority of cases of hypothyroid are caused by Hashimoto's. If your hypothyroid problem is not caused by Hashimoto's, then it will fit into one of 6 broad patterns, and I'm going to discuss these. TSH, which became the gold standard measuring thyroid function in the 1970s, is only able to consistently detect one of the 6 patterns. We talked about this a little bit before. So, okay, hypothyroidism and Hashimoto's. Hashimoto's is the most common cause of underactive thyroid. Now, this is the point I want you to get. It is an immune system problem. It is not a thyroid problem. Yes, the thyroid's not acting right, but it's because it's got a dog biting at its tail. It's got something that's going after it. You've got to calm the immune system down. You have to get the immune system under control and get it balanced and work through those issues and calm that down. That's the key. Does this make sense? So, as a matter of fact, let me just say this. Commonly, you'll see tyrosine and iodine in thyroid supplements. You go to the health food, I'm not talking bad about the health food stores. I like the health food store we have here in town. But you'll go there and you'll get the tyrosine, you'll get the iodine because that's supposed to be good for thyroid. Well, the problem with it is that when you put iodine in your system and you're Hashimoto's, it activates the antibodies to go after the TPO. So you can actually flare up a thyroid problem through taking iodine. So it's not a wise thing to do just to ad hoc take iodine. Iodine's good if you need it, but it's bad if you don't. It's not like bananas. If you don't need them or you need them, they're fine, they're okay, they taste good. But if you do this or don't do this, it's important. So it's important to know what you're dealing with. Here again, that's the reason why we run the antibodies, so we know, is this a Hashimoto's, is this not a Hashimoto's, so we know what we're dealing with. Okay? Does that make sense? Okay, Hashimoto's can be a paradox. So in other words, what will happen is sometimes if you have heart palpitations, if you have some of the symptoms that we talked about earlier, and then you're just sitting there and all of a sudden you feel like your heart's going to be out of your chest for a minute or two or a few seconds. Or let's say you just have this, or you can't sleep. That would be another one. Feeling those kind of inner tremors and feeling anxious and this kind of thing, or difficulty gaining weight. That usually doesn't happen, but that can happen with a Hashimoto's. The reason why that can happen is, watch this. When the TPO starts getting eaten up, that sounds so bad when I say that, doesn't it? When the TPO is getting gnawed on, that sounds even worse. I'm trying to come up with something better. When this problem starts, well, let's don't clean it up. When that starts getting eaten up, here's what happens. The thyroid gland, you can have surges because the white blood cells that are acting incorrectly and going after the thyroid gland can actually release a whole bunch of thyroid hormone in there because of what it's doing there, and it just squirts a bunch of it out, and all of a sudden, boom, 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 or you have these feelings. As a matter of fact, it's better run the antibodies. I believe wholeheartedly in running the antibodies. But if you have these conditions we're talking about, you feel the weak, the tiredness, the headaches, the different things going on, and then you intermittently have these symptoms, you probably are Hashimoto's. Probably are Hashimoto's. Okay? All right. According to the American Autoimmune Disease Association, approximately 50 million Americans, 20% of the population, or 1 in 5, suffer from autoimmune diseases. Women are affected more than men, but men are most definitely affected. Men are most definitely affected. Okay, so let's talk just a moment about Graves. We've picked on Hashimoto's, now we're going to pick on the Graves. And I'm only going to say one or two things about this because this relates to a lot of other issues here. You remember the TSH, and here is this is the thyroid cells. And there's receptors on that thyroid cells, and the TSH will come on there, and when the TSH hits that receptor, remember what I told you about what receptors do? It drives the cell and tells it what to do, right? Okay, so when you build an antibody to the receptor, this is the antibody to receptor, it'll come here and it'll go on that receptor and it'll just make it go hyperspeed. But guess what? It's still an autoimmune condition. You would go after it the same way you go after Hashimoto's, the same way. But it's still an autoimmune condition. It's still an autoimmune condition, okay? Okay, the most common trigger that turns an autoimmune gene, okay, oh boy, we're really going to get in the weeds here, but don't get panicked. I got to show you something real quick, and it'll go easy. It'll be just like good tasting vitamins or something. Okay. I'm going to show you two things. Don't look at this. This is scary. This may be scary, but less scary. Look here, don't look there. Okay. Now, when we look at this, when the body is attacked by a virus or a bacteria, or the body's growing cancer, or something like this is happening, the body has to have a mechanism by which it can eradicate that situation. It's called the immune system. Okay? So, we have two general pathways. Pay attention, this is very important. We have two general pathways that the body will use to fight whatever attack there is. So in other words, if you have something that comes into your blood, you're going to have Th2 pathway activated, and it's going to make those white blood cells that are needed to attack that or go after that. Does that make sense? Now here's the cool part about it. Many of the white blood cells are laying there in a state of what's called pluripotent, which means they can become any kind of cell. They're just waiting to be directed to be told what to do. Is that something? In other words, you don't have like you know, you look at an army, you say, okay, we have 20,000 foot soldiers, we have this and that. It doesn't work that way. You have white blood cells that are hanging out, waiting for something to happen. And then when an attack happens, the body goes through this process. This body goes through the process of activating one of these pathways to make it work right. It's really cool. So the Th1 pathway goes after things that are in the cells. Now this is important because if you have cancer cells, this is the one that's going to go after it. It's going to say, oh, you know, we've got too many cancer cells going on in that liver. And then the THOs, which are the undeclared cells, will go down this pathway and it'll go after that. Okay? If you have viruses, remember viruses actually attack the cells, bacteria go into the blood. There's nuances to that, but in general. So it'll go after viruses. So anyway, your first line of attack when something happens to your body is it goes this way, and this is the one that builds the antibodies over time. When people have autoimmune problems, it's usually because they're dominant over on this side. About 90% of Hashimoto's, they're dominant on this side. This is going to become very important here in just a minute. Not 100%. Some of them are dominant on Th2 side, but now when it comes to taking care of people that have a Hashimoto's or an autoimmune, we have to know which side is activated, which side is dominant. Because when we know which side is dominant, then we can actually apply nutrition and we can apply other things that will boost that other side up to bring you back into a balance. I'm excited about that. You all excited about that? That's exciting. Now I just want to throw this in here. This is just for fun. Okay, good. We'll see how much fun it is. Just to show you, during pregnancy, especially through the pregnancy, but the last trimester of pregnancy, your Th1 is going to become more dominant because you're not going to reject the baby. See, if this would be the side that would actually do that, well, and then right after the baby's born, then it flips up over the other way. And this is the reason why when ladies have a baby, sometimes things change. Like all of a sudden, my wife's hair was curly as could be. And then now we had her go get a curling iron because it went straight after she had Helly. You know, sometimes ladies can never have migraine headaches and then have a baby and then have migraines. Or the other way around, they can have migraine headaches and have a baby and no longer have migraines. Things change. But one of the things that's changing is that if you don't move through this shift good, that can cause a dysregulation and that can trigger this whole autoimmune thing to happen. Does that make sense? Okay. Let's talk about nutritional support. Okay, good. I was checking my time here. We're good. We got a few more minutes. Are you guys okay? Okay. Close the gates, and I'm going to talk a little bit about this. It's very important. Identify food sensitivities and eliminate gluten and dairy immediately. Hashimoto's has been found that nearly, I didn't say almost, and I didn't say all, I said almost, I didn't say always, is nearly always associated with gluten sensitivity. So you just got to get rid of the gluten. It stinks, especially if you like bread, but that's just the way it is. Hashimoto's, and this is not just me saying this is well documented, well studied, that gluten can activate the Hashimoto's. Dairy can, they say not as much, but it does. I just get people off of dairy. Vitamin D levels should be checked and kept at a high normal. This is for Hashimoto's. Or this is also would be for Graves too for that. So because vitamin D is important is important for the whole process of immune regulation. You need vitamin D. One of the worst things that ever happen is people slopping all that stuff all over their skin and acting like the sun was an accident. Like we shouldn't really have that that deterrent on our system. We need sun. We need sun. Matter of fact, I'll tell you, just like I tell vegetarians, they're going to love this. Go eat a steak. I'm sorry if I offended anybody, but that's another subject for another day. So, but anyway, get some sun. You need sun. Okay, high-level EPA and DHA fish oil. Fish oil is very important for this process. Glutathione, intravenous skin or nebulizer. Superoxide dismutase cream. These are just things that are listed that, let me explain this right here. This is step one. Somebody comes into my office, they are in a thyroid problem, they're in an autoimmune storm, they're in something's going on and things are falling apart. This is my first steps. I'm going to close the gates. I'm going to show you what that means here in a minute. We're going to identify food sensitivities, vitamin D levels. We're going to look at fish oil, glutathione, superoxide dismutase. In most cases, sometimes we may have a little change on that. But this is my checklist. It's like I'm getting ready to fly a plane. I walk around the plane, look at all the wings, look at the different things. This is my checklist. Step two is we need to establish the balance with the Th2, Th1 system. How do we do that? We got to figure out which one, what's doing what. Some of this we can do by symptoms, but others can be done by lab. The problem with doing a little lab, the labs are very expensive. So I think the lab to figure this out is, I don't know, $400, $500, $600. It's a pretty expensive lab, but if you can tolerate it, you can generally do a test dose of this, that, or the other. And if you're dominant on one side and you give somebody something that they're dominant in, then they come back and they say, like, I really feel bad after you did that. And you say, well, that's good. We just saved you $600. Now let's get you on the other stuff. Okay, so identify trigger and work it out. You got to find out what's triggering it and work it out. You got to maintain the gates. Maintain the gates. Okay, let's talk a little bit about the gates. What are the gates? This really should have been a 2-hour thing. I'm not going to make it 2 hours. I'm really going to cut this in just a little bit. But I've been talking fast. You think I'm hyperthyroid? I've been talking so fast. But I knew I had a lot of information to go through. And you know, we're doing our best to get through this, but there's just, this is a big subject, isn't it? This is pretty big. Okay. This is going to be important, whether you're a thyroid or whether you're a thyroid. I'm not a thyroid. Whether you have a thyroid problem or not, this is going to be important for you. Okay? I want everybody, this is very important. What slide we showed you a while ago? 50 million people, and that is estimated by some autoimmune society. Who knows how many? Because I'm going to tell you, as a practicing doctor, I see patients every day, and I will tell you, I think that number is quite low. I think that there's far more autoimmune conditions out there than we even realize, because we don't have the ability to test every antibody for everything. In other words, give you an example, Crohn's disease. There's no antibody that we can actually see that tells us, oh, that's an autoimmune problem, but we know what it is. But they'll come up with one. We'll see it. But there's a lot of people who just have undescribed problems that you just don't know. So these 4 gates are 4 gates that the body has that keeps things from getting in that causes problems. Okay? Fungus, bacteria, viruses, heavy metals, toxins, aspartame, MSG, all these other things that shouldn't be around us. If you're a Diet Coke drinker, I hope you heard that. There's something called GALT, salt, and I like to call it BALT. But anyway, the gut barrier. Within your gut, there's something called gut-associated lymphoid tissue. What that is it's a barrier between the outside world and what's going on inside. It's a dam, if you will. It keeps the bad stuff from coming in. If you eat something that has let's say you have something that has bacteria, or you have something that's building fungi or whatever, that barrier, if it's working strong, can resist it. That barrier can resist it. It's the way the body was made. I mean, if we couldn't fight off infections like that, none of us would be here. We'd already be dead. So lung barriers. There's barriers within the lung, because remember, when you breathe in stuff, that goes straight from the lungs right into the bloodstream. So there are barriers in the lungs. There are skin barriers. And there's a blood-brain barrier that keeps things from getting into the brain. Now, the health of our gates has a lot to do with turning on autoimmune genes. If you have a breakdown of any one of these gates, it is a potential for an autoimmune condition. And the reason why that is once you break down one of these gates, all kinds of things start going in there, and it starts causing an immune dysregulation. And then all of a sudden the immune system starts overactivating, and when it overactivates for a period of time, then it starts going after the body. And that's called an autoimmune condition. Does that make sense? Okay. I think that probably what I'm going to do I'm probably going to do a seminar, one of these seminars, solely on salt and malt. I think it'd be a tremendous seminar to do. I think you get a lot out of it, but I can't spend any more time with it now. Drivers of gait malfunctions. Did you know if your head's not sitting in the right position right there, it can put pressure on the brainstem? Actually, more specifically, it can interfere with the cerebral spinal fluid flow, and it can interfere with the blood flow in the brainstem. And when that happens, you can interfere with this process, and which we'll talk a little bit about, with the hypothalamus and the pituitary and so on and so forth. Poor diet. How many qualify for that? I'm not asking for raised hands. Unstable blood sugar. It's very important. When your blood sugar is unstable and it goes up and down in the gut primarily, and even in the brain, actually the brain too, when you have those swings of blood sugar, this is really hard on those gates. Chronic stress, chronic infections, adrenal malfunction, that's a major issue, and anemia. Okay, do you guys have 10 more? Do you have 10 more minutes? Are you okay? Okay. Good. Well, I mean, what are you going to say? I mean, so anyway, sorry. If you have to go, that's really okay. I'll completely understand. Okay, think about this. Gravity is the #1 stress on the human frame. And trauma years ago can cause problems today. Birth trauma, car accidents, slips, falls, bumps can cause the head to come over one way or the other. This can disturb that blood flow in there, and also cerebral spinal fluid flow. And when that happens, that can alter the way the brainstem works. Why is that important? Because the brainstem is the center of control of the autonomic nervous system. The autonomic nervous system has a lot to do with what's going on in that hypothalamus and the pituitary and all these other functions. Believe you me, when somebody has this problem going on, it can cause every one of these, even the thyroid problem itself. If we look at this right here, let's look at that. We can actually measure temperatures, and we can see how the health of the brainstem, because the brainstem does a lot of things, but it also regulates your skin temperature. So if your head's not sitting in that groove right, if your head's not on straight, it can disturb the function of the brainstem, as I was talking about, and it will alter your body's temperature from one way to the other. Patients that are in here, we read that on there. The head is tilted to the right, the atlas cervical, you can see all that. The head's supposed to sit in the cradle right there. And see this right here? This is the first vertebra right there. You see where the brainstem is? Now this is actually 7 weeks after we had adjusted that person. I just wanted to show that. This is not really that remarkable case. We see this happen, but I just wanted to show you what happens, what's going on in that brainstem is very important. A lot of things going on in the brainstem. You can see on that one. Look at that one. See that one right there? You can see a lot of different things, and you see the general curve right here, just like that. We actually published this in a professional journal. It did good, so. These aren't Weight Watcher diet pills. You've been reading them upside down. So, I will apologize for that, but I had to do it. I had to do it. Because, seriously, I said 10 minutes ago, but we really seriously just have about 10 more minutes. I was just trying to egg you on for a little while. Okay, 6 patterns of hypothyroid not related to Hashimoto's. Now, I'm going to zip through these. And here again, I don't want you to sit there and try to just soak up everything like a sponge. I just want you to kind of look at them and see if anything identifies. That's really why we have primary hypothyroidism, the only true thyroid dysfunction. That means the thyroid just really is not working. That can happen. And the only one that can effectively be managed through thyroid replacement hormone, that's the synthroid and the other things. And with that, you're going to see an elevated TSH and a low or normal T3 and T4s. Okay? All right. Hypothyroidism, secondary to pituitary hypofunction. Now remember, what does the pituitary do? It releases what? TSH, right? Into the thyroid. So the pituitary is releasing the TSH into the thyroid. And if you have a hypo-functioning pituitary, what does that mean? What's going to happen to TSH levels? They're going to go down, and if you don't have enough TSH, guess what's going to happen to your thyroid production? You're not going to make as much. Okay, so you remember the other scenario when we was talking about when you have the primary hypothyroidism, the TSH actually goes up. But the reason why is because the body's trying to wrap it up and kick the thyroid in the pants, if you will, trying to get more thyroid out of it. But in this case, the pituitary is just not working right. And the #1 cause of that, this pattern is related to adrenal fatigue. Busy lifestyle, poor diet, inadequate sleep, too much caffeine. Was you clapping your hands at that one? Oh, that's good. Good. No, that's good. High carbohydrate diet. I was looking for a clap or an applause line. Chronic inflammation, chronic viral or bacterial infections, etc. On this one, watch this. TSH below 1.8. Watch that. Remember I said clinical ranges were at 0.5, but we've delineated that the functional ranges, actually I have it, this has been well studied, and I'm just tagging on to what other people have done, but the functional range is anything under 1.8. So this is the person that's going to have a TSH about 1.4, somewhere in that area, and the T4 is going to be below 6, and they're going to have all the hypothyroid symptoms. This is the person, watch this, if I can do this, oh, great. Don't worry about it, it's okay. We'll get through this really easy, okay? Okay, so we have the hypothalamus, we have the pituitary, we have the thyroid, okay? Over here, we have a hypothalamus, pituitary, and adrenal cortex. Your adrenals, located right above your kidneys, they're your stress gland. That's what allows you to mount a defense against stress. They do so much more than that, but that's just one of the major things that it does. If this is not working right and it's, the adrenals are fatigued, what happens is because this is firing off and it's continually more and more cortisol, the cortisol comes up here and actually blocks the TSH from firing. But over a long period of time of this axis going on, this is the same hypothalamus, same pituitary, it begins just wearing this thing out. And the pituitary just stops being able to really produce the TSH like it needs. Does that make sense? This is very much a diet lifestyle. This is very correctable. Now you might need to go through, remember what I said, close the gates. You got to close the gates. You got to close the gates, but you can get this one taken care of. Thyroid underconversion. Chronic adrenal stress, here again, excess production of cortisol. This is one where you're making, let me say it this way, in the beginning stages of adrenal fatigue, your body will produce too much cortisol. In the ending stages, it's not producing at all because it's just losing it, but in that case, the pituitary is just not working right at all. So you'll see TSH is normal. See that? TSH is normal. Low total T3, T4. Thyroid conversion decreased. Okay. I want to say this one real quick. This one is one of the patterns that's elevated levels of testosterone in women produces this pattern. It's found in women with insulin resistance and that polycystic ovarian syndrome. You've heard of that, right? Polycystic ovarian syndrome. This is related to the thyroid. Guess what? TSH is normal here. See, that's the reason why I just want to point these out. Thyroid binding globulin elevation, usually associated with oral contraceptives. These things are really bad. And estrogen replacement therapies. You know, a lot of times people will get the estrogen replacement therapies. They say, "Oh, I feel really great." What they don't realize is they're getting ready for a crash, because this is, sometimes our job is to rehab bring them back through into some kind of normalcy. Thyroid resistance, and this is the last one we'll talk about. Pituitary and thyroid are working normally, watch this, but the thyroid hormones are not entering the cells, not getting the cells. TSH is normal. And thyroid resistance, let me just take just a moment of this. Thyroid resistance, when your tissue cells, remember the tissue cells are out here and you have the receptors out here. When it starts seeing too much thyroid, or here's the most likely condition, when you do things that are going to cause these receptors to blunt or cause these receptors to be less sensitive, then you're going to have thyroid resistance. If you have thyroid resistance, guess what? No thyroid's getting into that cell. No thyroid's getting in that cell. And here are things. BPA plastic. They found the BPA in plastic will blunt these receptors. Heavy metal toxicity, lead, mercury, sometimes from amalgams in your teeth. Do not go out and just get those amalgams out. If you get your amalgams out, mercury, make sure you go to a biological dentist or a dentist that knows how to do that to keep you safe. Because if you got them in there and you pull them out, you can activate that mercury and you can cause a big problem. But but that's not the only heavy metal toxicity. Did you know that today we have, on autopsy, 400 times more lead in our bones than we did 100 years ago on autopsy. So we've got a lot of lead floating in our system. We've got a lot of these things coming out. You know, these are good things. The chelation is very good for. Pesticides. When you're getting your food, I suggest going organic. It costs more. It really does. I understand that. I completely understand. I've got a household of four. So it's not 1 times me. It's like 4 times me doing, organic. But it's worth it because when you're eating organic, you're not getting these pesticides. You're not supposed to be getting these pesticides. And if you would like a list, I'll give you a list. There's some fruits and some vegetables that are more prone to pesticides than others. I have a list somewhere. I'll be glad to get to you. Stress. There's other things that can cause your receptors to go down. Okay, now we're at the fun part. This is the last part. We're in the home stretch right now. We just run a marathon. We're the last 100 yards. Can you do it? Here we go. I think I may have a thyroid issue. What should I do? The first thing I'm going to suggest, find a healthcare coach who understands this issue and can help you work it out. I mean, I all understand that, and that sounds like a self-serving thing, but I'm going to tell you what, it is that important. This is not just like, well, take a little vitamin C and see how you do. These issues are very delicate to work through, but the point is you can work through them, you just have to know what you're doing. And this is something you can do. Check your basal metabolic rate, BMR, for 10 days. Average underarm temperature should be 97.8. So menstruating females should do this following the 2nd day of cycle onset. Okay, look for the signs and symptoms already discussed in this presentation. If you've seen over 2 or 3 of the signs and symptoms, there's a likelihood that you may be suffering with thyroid issues. Have a comprehensive thyroid blood panel performed, including TPO and TBG. Would you say that's important? Would you say that's important from what we said? You better believe it is. Once identification of the problem has been accomplished, now it's time for you and your healthcare coach, your doctor, to design a strategy that will lead you to success. If it is Hashimoto's, then the strategy will be to close the gates, get the immune system calmed down and in balance, and eliminate triggers. If it is one of the 6 patterns discussed, go after the specific problem. And what I mean by that, it could be an adrenal fatigue causing it, it could be a blood sugar issue causing it, it could be a chronic infection causing it, it could be an anemia causing it. You got to find out why it's there. But we can usually ferret this out. And then retest. You must keep score. It is important to retest in order to know your success.